Waalaikumsalam.
Waalaikumsalam.
Right. So how many have we got here? How many of you should be?
It should be 37 students.
37.
Yes.
And how many have we got now?
36, including you.
35. 35 of you. Okay. All right, fine. So we should not punish those that are early, and probably one of your colleagues to probably have some problem with internet or something. Okay, let me see. Okay, so the topic for this afternoon. Sorry for the delay. I was busy in NSU just now. Okay, all right. So the topic for this afternoon is communication in pediatrics. This is a fairly new punya topic. It won't be long. Don't worry, it won't be long. This is a fairly new punya topic. Why we included this communication topic as part of your curriculum is that first we think uh, uh, firstly why I think is very important is because when we had because your group your third years, isn't it? Third year kan? So your group going through the new curriculum, and with the new curriculum we have the man OSCE station, where you have the communication, where there is a communication station. So communication station, sometimes we put, for example, we have a actor, mother, pelakon jadi mother atau jadi parent of a patient, and then you have a scenario where you need to counsel the parent. So and then we also have stations where we do like man OSCE, where we have patient and then you need to plug the patient in front of us, or you need to examine the patient in front of us. And what we have noted is that communication is really off. So your seniors banyak problem with how you communicate with patient. And that is one thing. The other thing is that we noted that if you look at history, if you look at medical legal cases, for example, I would say 90% of medical legal cases is actually because of communication breakdown, because of failure with communication, because doctors do not communicate well with their patients, doctors do not communicate well with their parents of the patients, doctors do not communicate well with their staff, doctors do not communicate well with doctors. So this is a huge problem. When you don't communicate well, so you would expect problem to happen because you do not communicate well. So this is why we think that having a session specifically talking about communication skills is actually very important, especially in pediatrics, because you don't just need to handle the patient, you need to handle the parent as well, you need to handle the caretaker of the patient. So having good communication is actually essential for you to survive well in pediatrics. So the first thing I wanted to highlight is that children, they are not small human. They are not miniature human. They are not homunculus. Children are not just mere homunculus. Children are by themselves. They have different cognitive development, different cognitive capability. They have different motor and speech capability at different ages of their life, and they have different upbringing. Different upbringing shows different abilities. eh? Children with different upbringing have different speech capabilities, for example. So certain upbringing, the children are more shy, they don't speak too much, they don't speak to adults. In our culture, for example, children are not supposed to speak with adults. Children speak with children. So in this sort of condition, sometimes it may be a bit difficult for you to get information from the children themselves. And parental expectation, sometimes certain parent have specific expectation of their children, and this expectation sometimes may affect how the children behaves, and so on and so forth. So children are not small human, children are not miniature human, children are not miniature adults, they are not homunculus, but children, they are they are special at different ages that they are in. So next thing is newborns are still to be communicated with, because banyak people assume if you handle newborns, if you handle newborn baby, kan buka mata pun tak berapa nak buka kan. So some people they don't communicate with babies. What I'm trying to tell you is even if they are newborn babies, you do need to speak to them. You do need to acknowledge them. They are human. They are human. They do have feelings. Newborn babies, you bukan boleh pergi cucuk pak, cucuk macam tu, pak macam tu. No, they do have feelings and you do need to acknowledge them. Newborn babies, they respond to social cues. They understand social cues. They understand your smile. Even though they do not have social smile, they don't respond back to your smile, but they understand your smile and they understand the tone of your voice. Newborn babies, you may be surprised. When you are angry, the tone of your voice differs. They actually understand that this is anger. If you're happy, they can understand that this is happy. So they do respond to social cues. And you need to remember as well, newborn babies, they sense, they can understand parental voice that they are exposed with antenatally. Allah says, Inna sam awal basar. Kan? At the stage of human, the first development is hearing and then sight. So that is proven scientifically. In utero before you are born, the first sensory that fetus develop is actually hearing and then sight. So they can understand. So that is why di orang-orang putih yang selalu buat kan, they put like a speaker and they let even babies in utero to hear uh, uh, music, to hear their parental voice and so on and so forth. The next is read. We do need to read to babies. Yes, of course, they don't understand. But the thing is, studies have shown newborn babies that are being read to, kalau kita baca buku pada these babies, they have better literacy rate. They have better speech development. So that is why we do need to read to newborn babies. Babies tu kita baca buku. This is the culture in European countries, in developed countries. They read to their babies. This has not been a culture in Malaysia. I'm so frustrated with this. We do need to read to babies. Yelah, dia tak faham. Bapak budak pun tak faham juga. So it doesn't mean you don't need to read to them. So you need to read to babies. If you do not inculcate this culture of reading from newborn period, how can you expect the babies to read later on and when adult? Tu yang jadi macam kita ni semua kan, tak reti-reti membaca. Tengok Facebook bukan main. Kan? Tapi membaca memang problem. So you do need to read to babies. And they understand, they respond to rhythmic sounds. Studies have shown children, newborn babies, ventilated newborn babies who are exposed to certain rhythmic sounds, they respond better, they are able to be extubated much earlier, sometimes classical music, for example, and readings of Quran as well. So they respond better and they are able to be extubated much earlier. Okay, so when you communicate with patient, with the family of the patient, so that session, that interview session, that communication session, it should be a planned session. You need to plan the session. Ideally, it shouldn't be an abrupt session. Even if the request is abrupt, you need to plan. You cannot just terus go. No, you need to have an idea and plan a bit. So the firstly, how to plan is you need to have clear objective. For that particular session, what is the objective that you want to achieve? The objective must be clear. In exam, for example, if we give you communication scenario, you need to be clear what is the objective. And that objective is actually we already give you the objective. So you need to understand the objectives clearly. What is the purpose of that session? And that session, that objective must be relayed upon. Semua yang hadir tu, all the participant, you, the patient or any other personnel, everyone need to understand what is the objective of that session. What do we want to achieve from that session? Do we want to speak about, for example, recently I have a mother whose child recently died, and the baby had a serious chromosomal disorder, Patau syndrome. So the objective is to actually counsel the parent about the abnormal chromosome result, and actually counsel the parent about bereavement. So that is the objective. So we need to be clear what is the objective. Do we want to get the parents to agree for palliative care? Do we want to get the parents to agree for not intubation, not for chest compression, not for active resuscitation? So what do we want to achieve? Do we want the parents to understand what is the mode of treatment? And so we do need to be very clear with the objective. Or is it just we want them to know the results of the test that we have done? So we must have clear objectives. Okay, next is you need to get appropriate personnel. For example, if you are male and you are meeting the mother, so probably you need a chaperone. Do you need a chaperone with you? And who do you need? Sometimes you need nurses to be with you in the session. Or do you need your MOs? You need other people? Do you need more senior people with you? You need someone from the hospital administration to come with you if you think there is potential medical legal issues. Do you need the legal team of the hospital to stay with you? Who do you need with you for the session? You need to call them. Do you need to call someone from language, a translator, for example? I've had sessions before where parents only speak Rohingyan. They don't speak Bangladesh, they don't speak India, they speak Rohingyan language, which is a different language. So we need to look for someone who actually can speak Rohingyan. So which personnel, what type of personnel do you want? Do you want, because if the patient had many issues, do you want physiotherapist, occupational therapist, surgeon, a psychiatrist, medical social worker? Who are the other personnel that you would want to be with you to counsel the patient? And then it should be at a scheduled time. Why scheduled time? Because sometimes you are busy, you have teaching, you have apa semua. You don't want while you are speaking with the parent, like just now before I came here, and I was speaking to a parent, then you need to rush for a teaching session, for example, or you need to rush, you need to answer call, you need to so on and so forth. So ideally, it should be a scheduled time. You need to free your time. You need to make sure that time is prepared for the communication or interview session. Then preparation. What are the equipments? If for example you have a baby who has chronic lung disease, who has a congenital cardiovascular disease, you need to teach the parents how to do CPR, for example. So do you need to have mannequin with you to teach the parents how to do CPR? Do you need information? If you're counseling about G6PD, for example, do you need to have pamphlets about G6PD to give to the mother? If you're counseling about asthma, do you need to have asthma diary, asthma action plan for you to give to the mother? And information, adequate information to be given to the mother, to the parent. And also you can ask the parents, okay, you can give the informations earlier for them to actually read first, and then they can forward you the questions and concerns early on, even before the session. And always when you start the patient, ask them, what are your concerns? Do you have any specific questions? And I always sometimes I tell them, so this is the objective of our current setting today. I hope you understand. Or do you have anything else that you would actually want to achieve? So sometimes for that, so that we all the participant in the meeting all have clear objectives of each other. Baru kita boleh capai. Bila kita tak ada hala tuju kan, kita hala tuju kita lain, dia hala tuju lain, memang no one will reach anywhere. So how to plan the settings, how to create the settings adequate and properly for a proper communication and proper interview session. So the plan the privacy, first the setting must have privacy. Sometimes you want to speak, for example, just now I have a patient who has a baby whose mother has major depression with history of suicidal intent before. So when I speak to the mother, obviously I cannot speak where other parents can hear. So it needs to be in a privacy. If you're counseling about HIV, for example, you need a setting where there is privacy. If you want to speak about COVID, for example, you don't want other people to know that the patient has COVID, because now we have COVID stigma. COVID stigma is actually worse than death. Kan? COVID stigma, satu kampung pulau. Padahal orang tu dah baik daripada COVID dah. Kan? So you need to have privacy. It needs to be comfortable. Kan? It needs to be in a appropriate, ada chair, sitting condition. Kan? Sebab sometimes apa? Sometimes people, sometimes if you break bad news, for example, you are telling the baby is dying, for example. Kan? Kita tak nak patient tu dia dapat vasovagal and then fainted, syncopal attack, for example. Sebab tu kita nak ada sit properly, it needs to be comfortable. The room should not be too hot, should not be too cold. So it should be comfortable for everyone that is attending. Yeah, and then you need to have appropriate personnel. Who else do you think you should call? I've had sessions before. We counsel the parents, but we need to call social worker. We need to call dietitian. We need to call occupational therapist to plan how to go forward, how to do chest physio at home, how to do limb physio at home, how to do, and so on and so forth. Do we need to call neurosurgeon? I've had session before where we do need to call ENT surgeon to come in, because we are discharging a child on CPAP, for example, on oxygen. So do we need to call anyone else? So appropriate personnel. Do we need to call translator? And the room must suit the purpose. The room must suit the purpose of the session. Kan? For example, if you want to teach about resuscitation, do you need the room to have oxygen? Do you need the room to have whatever equipment that you need? So the room where you handle the session must suit the purpose of the session. Appropriate room, appropriate equipment. Do you need mannequin to be with you? Do you need suction tubing? What else do you need? And it should be free from disturbance. Tak ada orang buat project, buat ketuk-ketuk apa, dan tak ada orang buat construction dekat nearby yang disturb the session. So it needs to have no disturbance. And then when you begin the session, introduction, how do you introduction? Firstly, always introduce all the attendees. This sama juga dengan when you do long case ke short case ke, because you are going to clerk the patient, you're going to examine the patient. Sama je. So, introduce everyone. So I am siapa, I am a medical student ke apa ke, and this is siapa lecturer, this is my lecturer, this is siapa, you introduce everyone. This is dietitian, this is siapa. So you introduce all the attendees, and not just introduce who they are and what is their job, you also introduce them what is their role. What is their role in looking after the patient? What is their role in the session that today, the interview session tu, apa function dia? Adakah you want them to actually teach the parent how to do physio? You want them to teach the parent how to comply with medication, how to prepare medication? Now, what do you want from them? So their role you need to introduce. You need to tell the attendees. So what are the role of everyone, and get consent. So bagi tahu, okay parents, mak, kita dah introduce semua, this is the function, this is the objective, and can we start? So today kita nak discuss pasal ni, is it okay? So can we discuss about this? So get consent to actually begin the session. Get consent to actually discuss about the topic that you want to discuss. Get consent to actually cover the objective of the session. Because when you get consent, you break the subconscious mind. They are going to be acceptable, easier for whatever you are trying to say. Okay, and then next is ascertain the objective. All attendees must know the purpose of the session, as I mentioned before. Make sure everyone is clear. You can even mention, you should actually mention the purpose of the session again before you begin. Next is know the background. Know the background of all the attendees. Now, of all the attendees, what is the forte of the occupational therapist, for example? What is the main area? What is the background of the parents of the attendees, background of the patient, for example? Know the background. know the language that they speak to. Tak boleh lah you cakap you can speak Malay English, parent can understand Malay, and then you call surgeon who cannot speak Malay, for example. Then you are in trouble. Kan? So know the language. You cannot call session, you panggil ramai-ramai semua datang, and then rupanya lah, parents cannot speak Malay, cannot speak English. Parents can only speak Chinese, for example. Then you tak prepare translator untuk cakap Chinese. And then Chinese pula ada banyak dialect. Hokkien, Cantonese, Mandarin, kan? Kung Fu, kan? Tu tambah-tambah lah. So there's many language as well. So you do need to think what is the language. Sometimes not just different race. Malay, I've had session before. The patient speak very thick Kelantanese dialect. I don't understand. When I was in Kelantan first time, I don't quite understand what the hell is this mother trying to say. Kan? So sometimes different dialect is quite difficult. I've had history, and now I can speak Kelantanese lah. But Negeri Sembilan, for example, my wife is from Negeri Sembilan. Previously, her grandmother, I never understood what her grandmother was saying. Cakap apa benda lah, I don't understand. I just smile and angguk. But they can do that to your family lah, but you cannot do that to your patient, kan? So actually you shouldn't do that to your family juga lah, kan? But so sometimes if you think the patient speaks in a very difficult dialect, Malay tapi difficult dialect, so get someone who understands and speaks that dialect as well. Because again, apa guna you call for the session for 1 hour or so when you guys don't understand each other, you don't understand them and they don't understand you, so that doesn't serve the purpose. So know the language that they speak. Sometimes you can ask, must we arrange the session to ask, are you okay with English, are you okay with Malay, macam mana. And then level of education, because different level of education, sometimes you need to go a bit different, kan? If they only go to primary school, for example, so the level of discussion should not be very high level. You need to go more layman. If they are doctors, for example, you cannot speak layman language. It's not because you are trying to differ between them. It's just that different understanding. Because if you speak layman with doctors, then they will feel insulted and you won't reach the objective that you want. But if you speak doctor language to layman, then that's going to be a problem as well. So that is why even Islam teaches us khatibun nas ala qadri ukulihim. Kan, you speak to human at the level of their akal, at the level of their intelligence, at the level of their understanding. So you assess what is their level of education, assess what is their work. If they are teachers, you need to speak in a different way. If they are lawyers, you do need to speak in a different way. If they are doctors, you do need to speak in a different way, because you need to acknowledge their career. People have struggled so much for it. It's not for you to rendahkan orang-orang ni. It's not for you to say they are inferior, they are superior. No, it is that you are acknowledging their careers, you are acknowledging their education, and you act accordingly. And the other issue is assess the level of prior understanding before you meet the patient. For example, everyone, because now people have information at their fingertips. So everyone has some idea about the disease. Everyone has some idea about the medication. Very rare now, people don't have any idea. Because before they meet you, they have Google. And many things in Google are weird and wrong things, fake things in Google. So you assess what is their level of prior understanding. Before they meet you, probably they have met someone else. Probably they have met nurses, doctors, other doctors junior than you, doctors from other department, GPs. So, and everyone may have been speaking about the same thing. So assess what is their level of prior understanding. So ask them, Mak, saya nak cakap pasal anak ni ada penyakit kencing manis. Sebelum ni ada tak doktor mana-mana dah cerita pasal ni? Apa yang Mak faham pasal penyakit ni? I always do that when I meet parents. I always tell them, ada sebelum ni ada siapa-siapa dah update pasal baby, apa yang dan tanya apa yang dia bagi tahu, apa yang mak faham, apa yang ayah faham daripada apa yang telah orang sebelum ni cerita. So ask them what do they understand, ask them what do they expect, apa yang mak harap. I've seen before a newly diagnosed diabetes in an 11 years old child, and the question that really affect the mom was apa yang mak harap. Sebab the mother we have expectation on our children. And bila our children has diseases, sometimes our expectation may differ, may affect, and so on and so forth. So ask them what is their expectation from the session, from the child, and from the treatment. So ask them what is their expectation. Assessing understanding is very important. I cannot highlight it enough. Again, assess understanding, ask level of comprehension. How deep do they understand about the disease? How deep do they understand about the treatment? How deep do they understand about the problem that we are discussing? How deep do they understand about everything that they need? And then assess the level of comprehension at every level before you begin. Intermittently between the session ni, tanya, okay, sekarang kita dah discuss dah 10 minit ni, faham ke? Ada apa-apa nak saya patah balik ke? After 20 minutes, you ask again. So assess at every level. And before you end as well, you assess their level of comprehension. Use language accordingly. Sometimes you do need to consider using language line. Language line ni, ada satu phone number ni yang you boleh call. Hospital kadang ada lah number yang you boleh call untuk have a translator. Sometimes you nak speak with Rohingya language, you nak speak Chinese, you nak speak Malay, you nak speak whatever language. Sometimes ada language line yang you can translate. You cakap, you pass phone macam tu. Ataupun do you need to call translator to come with you? And then avoid jargons where appropriate. Kan? Jangan guna perkataan besar-besar. Jangan guna jargon sangat. Mak jargon dia boleh guna jargon. Tahulah siapa mak jargon tu. Kan? So don't use mak jargon was my friend masa dekat London dulu sekarang dah jadi orang besar lah. Kalau tahu lah, kalau tak tahu tak apa, tak payah ambil tahu. So don't use jargon. Ideally avoid jargons where appropriate. But you do need to use jargon when appropriate. Kan? Jargon ni perkataan-perkataan besar-besar ni sometimes you do need to use. Sometimes if you speak with doctors, janganlah guna perkataan-perkataan layman. So you can use jargon because you do want them to understand few jargon. Contohnya G6PD deficiency. You want them to know the disease is G6PD deficiency. You want to know the problem is zinc. The problem is what? You do want them to know. You tak bolehlah translatekan everything. Kan? So especially you want them to know certain things. So the point is avoid jargons where appropriate and use jargon when appropriate as well. Next is cover the concerns, cover the assess and settle and make sure everything is covered. Ascertain what is the concerns of the patient and the parents, assess and cover, settle it. Make sure you actually cover and make sure that all the concerns are resolve their concerns. And then at every level, frequently reassess understanding, reassess the comprehension, reassess 10 minit, 15 minit, midway you assess. Okay, kita dah cerita apa yang mak faham setakat ni. Clear ke? Faham ke? And then before you end, always formulate conclusion. Okay mak, kita dah habis dah ni dah sampai ujung dah ni. Mak faham ke? Apa yang mak faham daripada apa kita dah discuss ni? Lepas tu, you formulate, okay, kalau mak dah faham, okay, sekarang ni kita dah plan kan, kita nak buat treatment. So treatment dia macam ni. Okay, mak setuju ke? Macam ni, macam ni, macam ni. Okay, setuju. Macam ni, setuju. Kena ambil ubat ni, setuju. Kita nak jumpa balik 2 minggu lepas ni, boleh? So formulate a conclusion together with the patient. Baru dia pun agree, baru dia pun comply to our plan of treatment. Kan? So formulate conclusion together with the patient. Okay mak, okay ke kalau ubat ni kita buat macam ni ke mak nak buat macam ni? Mak ubat ni mak nak ambil 2 kali ke 3 kali? Certain medication you can give BD or TDS, or you can give more frequent. So discuss with them. Okay, mak rasa mak comfortable ambil ubat ni 2 kali ke 3 kali ke berapa kali? So kita try formulate. We try to accommodate and make a joint conclusion with the patient. Kan? Berapa frequent nak jumpa fisioterapi, for example. make a conclusion together. Baru people comply. Bukan kita pula bagi instruction. Macam ni. Dan kita bagi dia ada some autonomy. Bila dia ada autonomy, baru dia akan comply to the treatment and management. Okay, other important points about communication. First, empathy. I cannot highlight empathy enough. Having empathy is very, very important. Not sympathy, empathy. Empathy, you can be emotional. Some people say you as doctors, you cannot be emotional to your patient. You cannot be emotional towards your patient, but you can be emotional together with your patient. If you're counseling a parent, the child has just died, it is okay for you to cry together with the mother, for you to cry together with the patient. I have cried many times together with my patient because I think it shows empathy. It shows that you understand their feeling, you get their feeling, you are feeling sad together with them. So you can be emotional to them, but you can be emotional together with them, but you should not be emotional to them. Right? Again, appropriate emotion, show appropriate emotion. Bila you cerita benda sedih, you kata anak dia dying apa semua, muka janganlah sengih kan. Minta maaf lah puan, anak dah meninggal. Buat muka sengih. Mana boleh, macam tu tak sesuai. Kan? Appropriate emotion. Kalau benda sedih, emotion pun kena sedih lah. Tone kena sedih. Minta maaf. Anak ni saya rasa dah nak meninggal. So muka pun kena muka sedih, suara pun kena tone yang sedih. Lower tone, lower frequency and so on so forth. Kalau benda gembira, janganlah muka sedih. Puan, saya rasa anak ni dah sembuh dah. Tak boleh lah. So appropriate emotion. Benda gembira, kita punya emotion pun kena gembira. Benda sedih, emotion kita pun kena sedih. So appropriate emotion to the setting and to the purpose. And understanding feelings. Understand the feelings of the patient. Kan? So, this is one thing I always need to remind. The problem with us as doctors nanti, kan? When you see so many problems, kan? Problem tu bagi kita sometimes kita rasa simple je, kan? Tapi for patient, sometimes it is big, sometimes it is major. It disrupts their life. So kita kena ada some understanding of their feeling. Kita rasa mungkin bagi kita simple sebab kita dah tengok banyak. We have seen so many problems. But for them, this is the first time they are facing this issue. Even if it is not the first time, having second, third, fourth time of the same disease is not easy. So try and understand their feelings. Try and understand, acknowledge the feeling that they are suffering. Okay, next, when you ask questions, ideally use open-ended question. Open-ended versus closed targeted question. So use open-ended question. Apa sakit hari ni? Apa masalah hari ni? Cuba cerita sikit apa jadi. Kan? Use open-ended. You allow them to actually tell the story of their problem. Kan? But sometimes you do need to give some closed directed question. Kan, kalau dia cerita meleweh sangat, sometimes you do need to ada some checklist. Ada muntah tak? Muntah tu macam mana? Kan? But again, close bukan yes no lah. Ideally bukan yes no. Ideally you close targeted. Boleh cerita pasal muntah tu. Boleh cerita pasal ni. So you ask them to tell more rather than just yes and no. So open-ended is always preferable, but sometimes you do need close directed questions. Faham tak pasal ni? And then do not feed words into mouth. Sakit tu ada rasa macam tingling atau rasa macam, sometimes when you feed words into mouth, parents, patient, dia dah sakit hati, ramai orang tanya, dia akan ya macam tu lah, macam tu. Sometimes they just agree to whatever you are saying. So be careful with feeding words into the mouth. Next is be a good listener. Be a good listener. Be a good listener. You can never be a good speaker without being a good listener. Always be a good listener. Many people, dia sakit, demam apa semua, jumpa doktor je jadi baik, belum dapat ubat lagi. Sebab apa? Sebab doctors are supposed to be good listener. You listen to their problem. Kan, tengah sakit apa semua, dia dapat cerita, and actually it lifts the burden off of them. So be a good listener. That's very, very important. Okay, next. Non-verbal. Oh, this is another important aspect of communication. Non-verbal communication. Very, very important. 80% of communication actually is achieved by non-verbal. Whatever you're trying to say, 80% is actually achieved by non-verbal. Non-verbal ni apa? Non-verbal ni includes intonation, the tone of your voice. Kan? Certain benda you need to give high tone, certain benda low tone. Kan? Your facial expression. You smile. Smiling ni is interesting because even if you wear mask, you can know whether the person is actually smiling or not. You can know. Pakai mask ke pakai apa, you can see that the patient is actually smiling. Body language, how is your body language? You macam muka tangan macam garang macam tu ke, ataupun you are open body language. So your body language will actually help. Macam mana kalau you duduk, macam mana cara you duduk landam macam tu ke, kan? So how you position yourself will actually help in the communication. Position of the body. Sometimes kalau kita duduk opposite, you duduk opposite, lepas tu ada satu barrier pula, ada meja ke ada apa. Sometimes it creates the subconscious understanding that you are opposite them, you are against them with the barrier. You are trying to protect yourself. Kan, they create barrier between you and the listener. So sometimes it's good, some other you be at 90 degree, ataupun sometimes you be side by side. Kalau tengah sedih, you be side by side because it shows that you are together with them. And then ambience of the setting. What is the ambience? Kalau benda sedih, ideally ambience should be a bit sedih. If it's happy, the ambience should be a happy punya ambience. Sometimes touching as well is useful. You touch them, touch on the shoulder. Dan kalau perempuan sama perempuan, dia kena ada dia punya touch dia dan sebagainya. So touching is also very, very important and very, very powerful as well. Next is mirroring. I'm not going to touch about mirroring. Just that mirroring, sometimes ni kita kena, contoh kalau patient tu duduk, you need to sit. If the patient is standing, you do need to stand. You tak boleh dia stand, you nak cakap ni, you duduk. Ataupun dia duduk, you cakap ni, you berdiri. It doesn't mirror. And when it doesn't mirror, the message is not carried across. So mirror them. Mirror the tone, mirror the body language. And this will help in understanding. Spikes. This is, if you look at papers, banyak akan sebut pasal spikes. Spikes ni apa? S-P-I-K-E-S. S is setting up the interview. How do you set up the interview? You need to mentally rehearse. You plan. Dalam your mental, you plan. You plan dalam otak apa akan jadi, apa you punya interview tu. You arrange the privacy, ideally sit down, use open body language. That is S. P is for perception. Elicit the patient's perspective. What is their perspective? What is their understanding of the issue? Assess what is their belief and their feel. Assess the appropriate vocabs, jargons, and the comprehension of the prior to the session. Invitation. Ask the patient what they want to know and obtain permission to share the knowledge with them. Rather than you impose your knowledge to them, but you ask permission for you to share the knowledge with them. Do not impose your knowledge to them. Next is knowledge. Provide information in small pieces because banyak sangat memang tak dapat. So give information in small pieces. Sometimes you do need multiple settings and use simple language. E is for emotion. Explore and explicitly recognize and empathize with their emotion. Explicitly recognize. You need to show that you recognize, you acknowledge their feeling, their emotion, and empathize with them. S is for strategy and summary. So before you end, always set out the medical plan of action and arrange for follow-up. Next is call for help. So call for help is first, before you end, offer to discuss with seniors. Okay, Mak, kita dah discuss banyak ni. Do you want to meet with my senior? Do you want me to refer you to someone else? Do you want me to refer to psychiatrist? Do you want me to refer to... Offer to refer. offer for follow up. Okay, kita dah jumpa ni, banyak ada benda kita discuss ni, ada banyak lagi benda nak kena discuss. Boleh ke kalau kita jumpa lagi 2 minggu? Do you want to, nak jumpa lagi tak? Ataupun you rasa dah cukup dah? Kan? So offer for follow up. What are other aids? Other aids are visual aids. Sometimes do you need visual aids? Do you need to draw? Sometimes when I speak to patients about cardiac diseases, for example, I always draw. Some people dia suka ada drawings dah, dia dah ada charts dia, it's okay. I like to draw, even though my drawing is bad, I don't really care. But so sometimes do you need to draw? Do you need to draw the upper airway? Do you need to draw things? Do you need to draw anything? So do you need to have the visual aids for you to help and get the information to be better? That's it. Simple. Simple ke tak simple? Simple lah. Simple kan? Simple ke tak simple? Simple. Boleh buat lah. Boleh buat lah.
InsyaAllah.
Kena buat lah kena buat lah. Sebab setakat ni your colleague saya belum menunjukkan lagi improvement sejak kita start this module ni. Aduh probably is the problem with the speaker kot. The lecturer mungkin kena tukar lecturer lain lah untuk bagi topik ni. We'll see how it goes. Okay, alright, fine. Any question? Any question? Any burning question? Any question?
Doktor.
Seorang yang
Faiz first.
Okay. Doktor, kita orang memang boleh refer patients to seniors ke?
Kejap. Salam. Okay, let's end our session with tasbih kafarah and surah al-Asr. Okay, Assalamualaikum.
Thank you, Doctor.
Thank you.
Thank you, Doctor.
Thank you.